Pittman. I'm 18 years older and I consent to this video.
Hi guys, I'm working with Ricky Everest today. I do want to let you know that I do have on gloves because I have little rashes and eczema going on, and they're kind of like crusty and bleeding, and I don't want to like touch all over the place with it. But I'm working with Ricky Everest today, and I'm checking in my patient provider's orders to see what we're gonna do for Ricky. And Ricky is getting his insulin list pro today. According to his medication administration record, he is on insulin list pro. So before I go my Pyxis, I'm gonna wash my hands. Okay, so I'm gonna log in. My username is 22CEPITTMA. My password is UWGSON. And I'm gonna click on Ricky Everest Insulin List Pro. But first, I need to check his glucose levels. Nurse Vanessa, do you know how? Do you know what Ricky Everest glucose level is?
Yes, it's a 310 right now.
Okay, it's a 310. So I'm gonna give him 4 units. Okay, so now I have my medication. I'm going to give Ricky Everest 4 units of Insulin List Pro, but let me make sure that I do in fact have the right medication for the right patient. Okay, so Ricky Everest, he's going to get Insulin List Pro, and he's going to get that 4 units via SubQ, and the expiration date is January 2021. Okay, so now I'm going to go back to my Pyxis. I'm going to log out of my Pyxis, and I'm going to close my drawer and log out of my Pyxis. Okay, now I'm going to come up here to my second med check to make sure I have everything correct. So I have Ricky Alvarez. He's on Insulin List Pro. He's going to get it. He's going to get his dosage of 4 units via SubQ, and he's getting it at 4:30 today. Alrighty, so I'm gonna grab some gauze, alcohol swabs, the medication, some gloves, and my insulin syringe. I got a Band-Aid too. Come in. Hi Ricky, how are you? So my name is Nurse Essence. I'm going to be in here for about 15-20 minutes. My shift is from 7 to 3 p.m. today. We see that you are very hyperglycemic today. Yeah. Okay, so I'm going to put on wash my hands right quick before I touch anything. Okay. So your bed is locked. It's at its lowest position. All 3 side rails are up. Your floor is clutter-free. You do have your call light right here, and your bedside table is here. So Ricky, we're going to give you your Insulin List Pro today. I want to make sure that I do have the right patient. So can you give me your first and last name?
Ricky Alvarez.
How old are you?
13.
Okay. Do you have any allergies?
No.
Okay, let me get your medication number. Your MRN is 1874238. 1874238. Okay, so let me verify that I have the correct medication for the correct patient, okay? So my patient is Ricky Alvarez. His medication is Insulin List Pro. He is getting 4 units via SubQ at 4:30, and the expiration date is January 2021. Okay, so now Ricky, I'm going to scan your bracelet right quick as I get ready to administer the medication. I'm going to click on the green button right here, and I'm going to scan your bracelet. Okay, now I'm going to scan your medication. Alrighty. So the red button has now turned green. So Ricky, I just want to give you a little information about your medicine. So your blood glucose level is at a 310. So that means you're hyperglycemic. And We want to lower your numbers because it's very high, and it's very abnormal. So your insulin response is gonna lower your numbers. It might lower it too much. You may become hypoglycemic, and you will feel shakiness. You may be a little dizzy, tired. But if you start feeling any of those symptoms, just call me and let me know, okay? All right. So, so now I'm going to just, get your medicine all set up. Do you have any questions for me? Can you repeat that information?
Basically that I'm hyperglycemic, and that means that my blood glucose is too high. And once you do my medicine, it's supposed to lower it, and it lowers it too much, then that means I'm be hypo. That means I'll be tired, shaky, and stuff.
Okay, just call me if you have those symptoms. Okay, so I'm gonna raise you up to working position. I want you to relax for me and stuff, okay? Alrighty, so I'm gonna clean the medicine vial for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm gonna let that dry for a few seconds. So Ricky, you have 3 places that you can get your injection. So you can get it in your posterior upper arm, your anterior thigh, and you can get it in your abdomen. Which place do you want it? Okay, so I'm gonna give it to you in your abdomen. Alright, so I'm gonna expose you just a little bit right here, and I'm gonna provide you with some privacy. Alrighty, and I'm gonna palpate and touch to make sure nothing is going on right here. No swelling, no edema, no tenderness, okay? Okay, everything looks good, and we're gonna give that to you in your abdomen. Alrighty, so now I'm gonna draw up 4 units of air to give air to your vial. Alright, I'm going to insert and give air. Now I'm going to draw back 4 units. I'm going to draw back a little bit more over to get the bubbles out. I have a few little air bubbles. I'm going to get them out. Alright, I'm going to safely reach out my needle. Okay, and I need my nurse, Vanessa, to come and let me know if I have the correct amount, because this is a high alert drug.
Yes, you do have the right amount.
Okay, thank you so much. So I'm going to leave that here. And now I'm going to wash my hands. I'm going to wash my hands, and I'm going to apply some gloves. Okay, Ricky, while I'm putting on my gloves, I want you to get relaxed, okay? Get relaxed for me and get comfortable so I can give you your injection. This is so hard to do it today. Okay. So now I'm going to clean your site. I'm going to start. Okay. Alright, I'm going to let that dry. I'm going to throw this away. And now I have your injection, your medication. So I want you to just relax. Alrighty. So I'm going to uncap the needle. And I'm going to insert it at a 90-degree angle. You can count with me for 4 seconds as I inject your medicine. 1, 2, 3, 4. Okay, I'm gonna hold it in for 4 more seconds. 1, 2, 3, 4. I'm gonna take it out. I want you to apply a little bit of pressure right there for me. I'm gonna throw away the syringe. Okay, let me take a look at that, ma'am, sir. Okay, everything looks good. Do you need a Band-Aid? No? No, okay. Alrighty, so I'm gonna take my gloves off. Okay, I'm gonna wash my hands. Perform a little hand hygiene. Okay, Ricky, so I will be back. I'm gonna stay with you for about several minutes to make sure you don't have an allergic reaction to the medication. And I will be back about 15 to 30 minutes to assess your site. Make sure that there's no redness, no edema going on around your seizure site. And I'll come back to take your blood glucose levels again to make sure that the medicine is actually doing its job, okay? Alrighty, okay then. So now I'm gonna, what am I gonna do? Okay, so I'm gonna chart my chart that I have given you your medicine. Right quick, okay, I gave it to you at 4:30 today. You tolerated it well. Okay. Alrighty. So now I think everything is finished. Nurse Vanessa, do you have some questions for me?
Yes, I do. Okay, the first question is, where is the preferred site for administering insulin or heparin?
Is in the abdomen followed by the thigh.
And when using the abdomen, how far from the umbilicus should the nurse choose a site?
You should be 5 centimeters from the left, right, or below the umbilicus area.
What is important to consider when a client receives frequent injections?
You might want to rotate around the anatomical region.
And what is the maximum volume to inject into a single SQ site for an adult or large child?
2 milliliters.
Okay. What is the maximum volume to inject into a single SQ site for a small child or infant?
0.5 milliliters.
Okay, that concludes questions.
Okay, well, thank you so much. I documented all of your info, that you taking your medicine, okay? So I'll be back about 15-30 minutes to reassess you. Your bed is locked, is at its lowest position. All 3 side rails are up. Your call light is here. Your floor is clutter free, and your bedside table is near you, okay? All right, let me know if you have any questions. Thank you so much for being a great patient for me today. All righty, thank you so much. Now I'd like to wash my hands before I leave.